What's your reaction when you go to do a simple blood test and find something that is totally unexpected? It usually starts as a boring form, until a number shows up that doesn't belong to you. If you want to know about what I'm trying to tell you, then this video is for you, because today we're unpacking kidney blood tests the way they're meant to be understood. As early warning systems, not medical code. We'll walk through what those numbers really measure, which ones quietly shift first, and how small changes often speak long before pain ever does. Let me be clear, this isn't about fear. This is about your health. The hook and the dashboard analogy. You know that feeling when you're sitting in the doctor's office just minding your own business and they hand you a stack of papers? You're scrolling through, everything looks fine, and then bam! There is a number in bold, or maybe it's highlighted in red. Suddenly, your heart does a little somersault. You weren't even feeling sick. That's the thing about your kidneys. They are the most polite, quiet organs in your entire body. They don't complain. They don't throb like a headache or ache like a pulled muscle. They just work in the background, 24/7, filtering out the junk so you can keep moving. Think of your blood test like the dashboard of your car. Most of the time, you're just looking at the gas gauge or the radio. But these kidney numbers, they are your check engine light. If that light pops on, it doesn't mean the car is going to explode in the next 5 minutes. It's just the car's way of saying, hey, something under the hood isn't firing right. This video is about teaching you how to read that dashboard before you end up stranded on the side of the road. We aren't here to panic. We're here to look at the sensors, understand the data, and realize that a weird number isn't a death sentence. It's an invitation to take care of the machine that takes care of you. We're going to peel back the medical jargon and talk about what's actually happening in your pipes. The silent engine, why kidneys don't scream. Here is the scary part that nobody tells you. Your kidneys are almost too good at their jobs. Imagine you have a team of 10 workers. If 5 of them quit, the other 5 just work twice as hard to cover the shift. You wouldn't even know half the team was gone because the work is still getting done. Your kidneys work exactly like that. You have millions of tiny filters called nephrons. You can lose a huge chunk of them, and because the remaining ones pick up the slack, your body feels totally normal. You might feel a little tired, or maybe your skin feels a bit itchy, or your ankles look slightly puffy after a long day. You'll probably just blame it on getting older or not sleeping enough. That silence is why these blood tests are actually a gift. By the time your kidneys actually start screaming with real pain or major symptoms, you've already lost a massive amount of ground. They are non-sensory organs when it comes to early damage. They won't tell you they are struggling until they are nearly at the finish line. That's why we have to look at the chemistry. We have to look at the microscopic evidence of how they're handling the pressure. If we wait for the body to tell us something is wrong through pain, we've waited too long. We're looking for the quiet shifts, the tiny movements in your lab results that happen long before you ever feel a symptom. This is about catching the problem while it's still just a conversation between you and your doctor, not an emergency. Sensor 1, EGFR, the speedometer. When you look at your lab results, the EGFR is usually the first thing your eyes jump to because it looks like a grade. In the medical world, we treat this like a speedometer. It tells us exactly how fast your kidneys are cleaning your blood every single minute. Now, if you're looking at your results in 2026, you might notice things look a bit different than they did a few years ago. We've moved toward a more accurate, race-neutral way of calculating this number called the CKD-EPI 2021 equation. It's a fancy way of saying the math got better, so your results are more about you and less about a broad category. So let's talk numbers. If you see a 90 or anything higher, you're in the green. Your engine is humming, the filters are clear, and everything is moving at top speed. But once that number dips between 60 and 89, you've entered the yellow zone. This is stage 2. It doesn't mean your kidneys are failing, but it's the body's way of tapping you on the shoulder and saying, "Hey, pay attention." The real line in the sand is 60. If your eGFR stays below 60 for more than 3 months, that is when doctors officially use the term chronic kidney disease. But here is the thing I need you to hear. Do not freak out over one single test. The E in eGFR stands for estimated. It's not an absolute measurement like weighing a piece of gold, it's a calculation. Your number can bounce around like crazy. If you didn't drink enough water before the test, your number will drop. If you had a massive steak dinner the night before, your number might look wonky. Even your age plays a role because, let's be honest, a 70-year-old's fast is different from a 20-year-old's fast. One bad reading is just a glitch in the system. It's a snapshot of one moment in time. We don't worry about the one-time dip, we look for the trend. Is the speedometer steadily dropping over 6 months, or was it just a bad day at the lab? Context is everything here. Sensor 2, creatinine, the exhaust fumes. If eGFR is your speedometer, then creatinine is the smoke coming out of your exhaust pipe. Creatinine is actually a waste product. It's the trash left over from your muscles just doing their everyday work. Your kidneys are supposed to grab this trash and throw it out in your urine. So, logically, if your blood test shows a lot of creatinine just sitting there, it usually means the garbage truck, your kidneys, is running behind schedule. For most people, the sweet spot is somewhere between 0.7 and 1.3. However, this is where it gets tricky, and why you can't just Google your number and assume the worst. There is something I call the muscle paradox. Imagine a 250-pound professional bodybuilder. His muscles are breaking down and rebuilding constantly, so he is producing a massive amount of exhaust. His creatinine might be 1.5, which looks high on paper, but his kidneys are actually perfectly healthy. They're just trying to keep up with a huge workload. Now, flip that. Imagine a very thin, frail grandmother who doesn't have much muscle mass at all. Her creatinine might be a perfect 0.8, but because she produces so little waste, her kidneys might actually be struggling to even clear that small amount. This is exactly why we don't use creatinine as the final word. It's just one data point. It's the exhaust, not the engine itself. If you've been hitting the gym hard, taking creatine supplements, or even just eating a lot of red meat, your exhaust is going to look a bit dirty. A good doctor knows this. They don't just look at the 1.4 and start a treatment plan. They look at your body type, your diet, and your lifestyle to see if that high number is actually normal for the person sitting in front of them. Sensor 3, bun and cystatin. C, the backup cameras. Sometimes the speedometer and the exhaust pipe give us conflicting stories. That's when we bring in the backup cameras, bun and cystatin C. Bun stands for blood urea nitrogen. It's another waste product, but it's a bit more sensitive than creatinine. The problem with bun is that it gets distracted easily. If you're on a high-protein keto or carnivore diet, your bun is going to spike. If you're dehydrated from a long flight or a workout, your bun will go up. It's a helpful tool, but it's not the most reliable witness in court. It tells us the kidneys are slow, but it doesn't always tell us why. That brings us to the gold standard that most people haven't even heard of, cystatin C. If your eGFR is sitting right on the edge of 60 and your doctor isn't sure if you actually have a problem or if it's just your muscle mass messing with the results, they order a cystatin C test. This is the tiebreaker. Unlike creatinine, cystatin C doesn't care how many weights you lift or how much steak you ate for dinner. It's produced at a constant rate by almost every cell in your body. It is the unfiltered truth. If your creatinine-based EGFR says you're at 55, stage 3, but your cystatin C-based EGFR says you're at 75, you can breathe a sigh of relief. It means your kidneys are doing better than the basic test suggested. It's like having a high-definition camera that cuts through the fog of your diet and your muscles to show exactly how the filters are performing. If you're worried about your numbers and your doctor hasn't mentioned this test, ask for it. It is the most honest conversation you can have with your labs. The urine test, ACR, the early leak detector. Most people think a kidney checkup is all about the blood work, but if you really want to catch a problem before it starts, you have to look at the trash coming out of the machine. This is where the ACR test comes in. ACR stands for albumin to creatinine ratio. If you want a simple way to visualize this, just think about your morning cup of coffee. Your kidney is essentially a high-performance coffee filter. Its job is to let the liquid, the good stuff, pass through while keeping the coffee grounds, the waste, trapped inside. In this scenario, albumin is the coffee grounds. It's a protein that is supposed to stay in your blood, not end up in the pot. If your lab report shows albumin in your urine, it means there's a hole in your filter. It's that simple. Now, here's why this is the ultimate early warning system. Those holes usually show up way before your blood numbers ever move. Your EGFR might look perfect, and your creatinine might look totally normal, but the ACR is already whispering that something is wrong. It's like finding a tiny puddle of oil on your garage floor. The car still drives fine, the engine isn't smoking, and the gauges look good. But that little leak is telling you that a seal is starting to fail. If you catch it while it's just a leak, you can often fix the pressure or the underlying issue before the whole filter gets shredded. If you're only checking your blood and ignoring your urine, you're missing the earliest chance to protect yourself. Interpreting the yellow lights, the stages. Let's talk about the stages. People hear stage 3 and their mind immediately jumps to the worst-case scenario, but I want you to look at these like traffic lights, not a countdown clock. Stages 1 and 2 are your green and blinking yellow lights. Your kidneys are still doing the heavy lifting, but maybe there's a little protein in the urine or a slight dip in speed. This is the observation phase. This isn't the time to panic, it's the time to check your tire pressure, specifically your blood pressure. Stage 3 is what I call the action phase. This is the 30 to 59 range. This is where most people get their wake-up call, and honestly, it's the most important place to be. Why? Because this is the sweet spot where you have the most power. You are in the driver's seat here. You can't necessarily undo the wear and tear, but you can absolutely stop the clock. Many people live in stage 3 for 30 or 40 years and never progress to anything worse. It's only when you hit stage 4 and 5 that the light turns red. That's the critical phase. That's where we stop talking about lifestyle and start talking about specialized protection and heavy-duty medical intervention. The goal of everything we are talking about today is to keep you firmly planted in those early stages. A stage 3 diagnosis isn't a cliff, it's a crossroads. Maintenance, taking control. So, what do you actually do when the dashboard lights up? You have to address the big two. If you look at the stats, nearly 75% of all kidney failure comes down to just two things: high blood pressure and diabetes. Think of high blood pressure like a power washer being used on a delicate lace curtain. Eventually, the fabric is going to tear. If you can get your blood pressure and your blood sugar under control, you're taking the literal pressure off your filters. The second thing is to stop throwing gunk into the engine. I'm talking about NSAIDs, common over-the-counter painkillers like ibuprofen or naproxen. For a healthy person, an occasional dose is fine. But if your warning lights are already blinking, these drugs act like a wrench in the gears. They constrict the blood flow to the kidneys and can cause a glitch to turn into a permanent problem. The ultimate truth is this: you don't really fix a scarred kidney. Once a nephron is gone, it's gone. But here's the good news: you have millions of them. You only need a fraction of your kidney function to live a long, healthy, normal life. The goal of reading these tests and understanding these numbers isn't to reach perfection. It's about preservation. It's about keeping the workers you still have on the job and making sure they don't have to work in a toxic environment. You have the data now. You know how to read the sensors. Now, take the wheel and keep that machine running. Knowledge is your best defense, and you just took a massive step toward mastering your own health. Those numbers on your lab sheet aren't just ink. They are the roadmap to your future. Keep your filters clean, keep your pressure low, and stay ahead of the curve. Your kidneys have your back. Now you have theirs. Thanks for being with us. Don't let this vital info vanish. Hit that subscribe button and tap the bell to keep your health dashboard crystal clear.